So I'm going to talk about Rural Missouri Needs Telehealth by Jung Sun Lee. I'm an intern at Missouri Rural Health Association. So what we're going to talk about today is what is telehealth and why we need telehealth in rural Missouri and how can telehealth benefit your life. And I'm going to mention some of the challenges that telehealth has. So what is telehealth? Telehealth is sometimes called telemedicine. It lets your doctor provide care for you without an in-person doctor office visit. Telehealth is done primarily online with internet access on your computer, tablet, or smartphone. So we need telehealth in rural Missouri, and I'm going to say some reasons why. First reason I want to bring up is that COVID-19 has been happening. The pandemic has been happening. It has almost become a necessity to have telehealth because we don't want any risk of getting exposed to the COVID-19 virus. And since need for other residents, that's a huge risk for them to carry just to go to the doctor's office to be in contact with that disease, with the virus. Second reason is the healthcare workers have been burning out. They have been working nonstop, dealing with COVID-19 patients and dealing with regular patients who really need help. So they've been having a really hard time. And 30% of the residents in Missouri is a rural resident, and that is 97% of the whole territory, which means there's only 30% of the people living in the rural areas, and the death rate is significantly higher than the urban areas. I mean, in ratio wise, it's basically about the same amount of people, but in rural areas and urban areas, there's a different population of people that live there. So if 30% of the population is losing the same amount as 70%, that is not a good thing. And the projected population, I brought out this map. If the areas are red, that means that they are going more red towards the red color. They're going to be losing more people in that area. And that is just not good because it's going to be harder for them to harder for that town to develop with less younger people in the town. And it's harder for people to even access things that urban people can get really easily. Right now, there's a lacking number of specialists in the state of Missouri. It's really hard for people to even travel to go to the doctor's office. My supervisor's grandmother told us that it took her 4 hours to even go to the doctor's office, and that is a huge amount of time compared to 10 minutes just meeting with the doctor or specialist through online. And there's a huge rising problem with mental health in rural areas. Farmers and ranch owners, their suicide rate is 3.5 times higher than the general population in suicide rate, which is absolutely absurd. I'm going to talk about now some challenges of telehealth. Right now, elders are skeptical of telehealth. They don't think it's effective as in-person visits. They are not familiar with this. In some rural areas, don't even have the technology to support telehealth. The technology is undeveloped. Medicare also has some restrictions to some complexity in getting funding. There's a risk of prescribing the wrong amount of medication. There's licensing issues with other states, but thankfully this waiver came out to help that situation. So this is the CMS waiver, and it was a waiver signed in March 2020 by Donald Trump, and Medicare will pay for payments for services to patients who use telehealth across the country. So before this waiver, Medicare only paid for a limited basis. So you couldn't get fully covered even when you get a telehealth. And there is a lot of risk paying a lot of money if you're going to meet a different state doctor. But this waiver reduced and waive costs like for the telehealth visits, which was immense help for a lot of people, I'm assuming. And there's three main types of virtual services, which is the Medicare telehealth visits, virtual check-ins, and e-visits. So I found this chart that was really helpful because I wrote down all the laws that need for the medical visits, the virtual visits that you might need. But this narrowed it down really easily. Like, what in real time are you meeting? What do you need? Where do you have to be on? It was very simplified, and like telehealth. What is it? Which is the medical telehealth visits is it's going on in real time, and you need video or pictures. Um, Virtual check-ins, like there's two types that you can use, and like e-visits, like it doesn't have to be on time, but the patient is just on a phone meeting with a doctor or a specialist, which is really easy for some people. I wanted to talk about this because I wanted people to be more familiar with telehealth. I know, as I mentioned, others are skeptical new with this kind of tool that they can use. What if your 4 hour day visit comes into a 10 minute, uh, only 10 minutes of the day? You can do whatever you want after that day, or maybe someone in your family needs an emergency. The closest doctor is 4 hours away, and we just gotta make an emergency call. Someone picks up, lets you know what to do, the procedure, and is there with you, helping you out. Um, and there's actually a high level of satisfaction about this about this tool. A lot of people who use this actually love it. They feel like it's actually helping them because the doctor is there talking with you, not physically, but still there to help you. And I wanted people to know that there's this tool out here to help rural residents out, because rural residents, it is hard for them to access healthcare. And that is not fair because all of us deserve healthcare. Our health is the number one priority. We need farmers in our society to go on. We need we need people who in the rural areas. So then none of this world would be of moving on the way it is. And I think telehealth is the way to help these people out. And I mentioned these problems. I mentioned some challenges because I really think that this needs funding to help rural residents out. I really think that laws need to be changed. So if the waiver's gone, it's just going to be the same for some residents, and they're going to spend their whole day trying to just meet a doctor and try to get help for their health when they can just end it in 10 to 15 minutes. Um, yeah, thank you.